Ideas that were once considered extreme, fringe, radical in 2016 when Bernie Sanders talked at them, the Democrats are now trying to make them mainstream. But watch this. House Democrats are running away from Medicare for All. Initially, 124 House Democrats liked Medicare for All. That support has now dropped to 107 Democrats. Centrist Democrats really worried about this rollout. The rollout was shaky. Again, the Democrat support for it falling. Let's bring in healthcare expert Seth Denson. He's the president of GDP Advisors. Seth, this bill would rip away all private health insurance for everybody, for 160 million Americans. It would get rid of Medicare and Medicaid. Everybody would be in the same government system. Your take on the Democrats now running away from it?
Well, listen, there's no question that we have a health care concern in the United States. The rising cost of health care is unsustainable at the rate that it is. But because that feeds the rising cost of health insurance. The challenge, though, is giving it away for free, giving access to an expensive system away for free doesn't drive down the cost, and it has to be paid for.
Yeah, that's the point, because as soon as that taxpayer money runs out, you have rationing, you have lines, you have caps. I mean, the Democrats are now realizing, hey, let's tinker with what we got. Let's fix what we got. Obamacare, for example. You look at the health stocks getting crushed today, the middlemen, the Express Scripts gang and the Cardinal Health stocks really getting hammered. You know, when you read through this bill, Seth, it should, critics say, scare all Americans. Here's what's in the bill. And Seth, you've talked about this. Come to me and talk to me about this. The Health and Human Services Secretary would appoint bureaucrat regional directors to oversee all hospitals, clinics, and doctors, and they dole out lump sums to pay for medical care. Talk to us about that.
Well, right now, the insurance company gets to be the bad guy when they deny a claim, right? Well, now Uncle Sam will be the bad guy in this system. Uncle Sam ultimately will get to determine who does and doesn't get care. They're talking about in this most recent bill, everything being run through what's called block granting, effectively giving out sums of money to hospital systems to give out care. But the problem is when it's completely free and there's no requirement of financial liability from any consumer, they're just going to get more of it.
Yeah, and so you know what's interesting? Roll Call is now reporting that Democrat support for this is plummeting. Just 25% of freshman House Democrats like this. Again, it went from 124 to 107. And, you know, Seth, centrist Democrats don't like it. Tom O'Halloran of Arizona, Scott Peters of California, Abigail Spanberg of Virginia. They're saying 100 Democrats, that's not a mandate for this right now, right?
Well, there's not, and the problem is Democrats will remember that when the Affordable Care Act passed, they lost power very quickly, and the Republicans used that as a rallying cry. The bills that are being introduced are massively farther left than what the Affordable Care Act was, and so those Democrats that have have long-term memory, right, are remembering that they lost when this was what they stood for.
Seth Denson, thank you so much. Really appreciate it. Come back again soon.
Good to be with you.
There's a lot of action happening with stocks.